Hello, and welcome to another segment of Elder Abuse Awareness Virtual Coalition. My name is Elisa Gwilliam, and today I have the pleasure to be talking to Director of the Orange County Office of the Aging, Murray Maglione, Professor of Psychology and Director of the Center of Aging and Disability Policy at Mount St. Mary's College, Dr. Larry Force, and our special guest today, Meg Boyce, the Executive Director of Alzheimer's Association, and Sharon Murray-Cohen, the Executive Director of Jewish Family Services of Ulster County. So thank you for coming and welcome. And today we're going to be talking about specifically how your two agencies have seen elder abuse develop since COVID-19 began. So Anne-Marie, do you want to start us off?
Anne-Marie, I think we're having a problem with the mute button. So while you're doing that, I can move this forward. Alyssa, thank you for moderating, and Meg and Sharon, thank you so much for joining us. Both of you bring a skill set that is unbelievable, not only based upon knowledge and experience, but also based upon your passion. As Alyssa said, Meg, you representing, the Alzheimer's Association, and Sharon representing Jewish Family Services. What we really like to talk about, and I'll turn this over to Anne-Marie, but what we really like to talk about is a couple of things. Some of the experiences you're having, because no one ever expected this COVID-19 situation. And also the real takeaway message for our listeners is the fact that you're available. Even though you might be working remotely, your organizations, you are definitely available for information, resources, and help. So with that, Anne-Marie, I'd like to turn it over to you.
Thank you, Dr. Force. And I definitely want to piggyback on what he says. Office for the Aging works so closely in partnership with Jewish Family Service and the Alzheimer's Association that, I always say there's always good that comes out of bad things. And what's come out of this pandemic is the strength and camaraderie that we have with our partners, and that specifically is Alzheimer's and Jewish Family Services. We would not be able to do and provide the services that we provide at this time in the unique way we had to do it, and we had to ramp up from 0 to 60 to do it without your two organizations. Elder abuse is just rampant right now. I always say it is an epidemic during a pandemic, and because everyone is sheltering in place and they're socially isolating, it's just a prime target for older adults. So I'm thrilled that you two are here, and it's so nice to let everyone know what great partners we are. So thanks for being here.
So Meg, at this point, would you like to, lead us down the path that you're now living?
Sure.
From what used to be, very predictable, now in a world of everything being unpredictable.
Yes. And thank you, Anne-Marie, for that nice introduction. So yes, this pandemic has greatly hit our community in various ways. Yes, there is increased concern of elder abuse because of the lack of respite services currently available. We do have a respite grant that we do offer families, and most of them utilize it for social model day programs so that they get a break. Their loved one actually is out, in the community, keeping themselves busy. The loved one can stay at home, the care partner, caregiver, and be able to just relax. And to not have that service right now is extremely stressful on both of them. We have the reasons for our constituents calling us have definitely changed over the past, we're finishing up week 11, working from home. And it really was primarily because of suddenly the lack of services available in the community. What the Alzheimer's Association was able to do was we were able to turn on a dime. We, in 48 hours, had our 24-hour helpline up and running with our contact center staff at home. We turned all of our support groups, our caregiver support groups, either telephonically or virtually. All of our educational programs telephonically or virtually. All of our joint enrichment activities are virtual, and we have been supporting our constituents in learning how to use this technology. I think that was our biggest fear, was in trying to support our constituents. We are trying to reach a population that doesn't feel comfortable with technology. But we were able to do some trainings. We've done one-on-ones with caregivers, and especially those individuals who had that respite funding for Social Model Day that now don't have that. They're turning to our virtual joint enrichment activities to at least get some kind of stimulation, and they're actually really enjoying it. But the other issue that we have had is this virus has greatly impacted our constituents. We have had people with the disease die. We've had caregivers die. And the stress on caregivers, and this is also where I could see abuse potentially happening, is someone with a memory impairment is not going to remember the guidelines. They're not going to remember to wash their hands. They're not going to know, what do you mean I need to wear a mask? If they go to a doctor's appointment, they have difficulty understanding and rationalizing the reasons why suddenly all these changes are happening. And so caregivers are under a lot more stress, and they're trying to figure out how best to support their loved ones. And so that's what we've been here for, to try to hopefully cut back that amount of unintentional abuse simply because of caregiver burnout and not getting that break that they're so used to getting. And so, I think that's all I have to share right now. We'll see what else comes up, but that's kind of like in a nutshell what we're currently experiencing.
Mm-hmm. Mm-hmm.
And I know that there's an intersection between the work that you do and the work that Sharon does and the people that you serve. So, I think it's clear that you said, and I think to your credit and to your organization's credit, I like what you said, we turned on a dime. You really didn't miss a beat in being able to be present for people. And, as we're continuing this conversation, we're going to circle back and ask you about how can people reach you because of the fact that you are still available. And Sharon, welcome to this Elder Abuse Awareness video cast. And maybe you could talk a little bit about what a day in your life looks like now that we're in this, new arrangement. You're on mute. Beautiful.
One of the things that has been most difficult for us, our agency, much like Meg's did, is we ramped up. We were able to put things in place, have our call-in within 48 hours up and running, somebody staffing it on a daily basis. Put all of our caregiver support groups on Zoom so we could do them virtually. Began to do the Ulster County Elder Abuse multidisciplinary team meeting on Zoom. The unfortunate thing for us was we had gotten and still have the grant to do EMDTs in the 5 counties in the Mid-Hudson. It got stuck in the pipeline. We finally got the contract through last week and are going to be able to actually start working on it June 8th, hopefully, if nothing else happens. But the most difficult thing for us is twofold. One is for the Holocaust survivors. We are out in the community. We do visits to them on a monthly to weekly basis, depending upon what the person actually needs. And we can't do that. Many of these individuals, we can do call-in, but the majority of these individuals may not have family.
Mm-hmm.
They do have home care, but somebody has to monitor the home care. And if we don't have a case manager going in there, it gets a little concerning. In addition to that, behavioral health care ramped up and went to telemedicine. One thing they forgot initially is the populations that we serve, for the most part, don't use computers.
Yeah, yeah.
And until, I think it was 2 weeks ago, telephones were not billable. So, that presented some interesting problems. What my agency did was my social workers continued to make contact with their clients via telephone. And once CMS finally agreed that that was an appropriate manner, we are now able to back bill all the way to March. So it's a good thing that they continued it for not the billing purpose, but for the actual need of the client.
Right.
People are isolated, and our volunteers, for the most part, are seniors. So they're not going out and doing in-home visits, friendly visits to people either. They can make telephone calls, but they can't go visit. And human contact is so important to people.
Mm-hmm. Those calls are so important, Sharon, that you do. I get people calling me. We've moved our New York Connects number to 7 days a week. And,
Good.
Early March, I had a lady call me because she needed some meals. And said we're in our 11th week. She calls me once a week now, and we probably talk for 15 minutes. Really about nothing. We talk about the weather. I ask how she's doing. It's that human interaction is so important. So we don't do, we've curtailed our home visits also in case it's a real emergency, but we're doing friendly visitor calls too. And again, Jewish Family Service, I can't say enough about you guys. You've switched to doing friendly phone calls. You go grocery shopping, you pick up prescription drugs. You have just changed the way you saw the need and you adjusted to the need, which has been really wonderful.
And I'd like to say something, to the three of you, to Meg and Sharon and Anne-Marie. And the three of you represent agencies. And in representing agencies, there was a lot of regulatory oversight. Like even in my private practice, if I wanted to see somebody virtually 6 months ago, I had to go through a HIPAA compliant website. Otherwise I'd be, violating, codes of confidentiality. Today, because the regulatory oversight has been removed, as Sharon said, about the telephone, you're able to actually engage with a participant, a client, or a patient, depending upon what arena you're in. And this becomes a service that is considered to be complete, whereas before it was considered not to be complete. Mm-hmm. So with these changes, there has been a release or a removal of these guidelines. From where you sit, the three of you, I mean, it's had to make it easier for you to navigate, but is there a concern about it, resurfacing? And Meg, I'd come to you first. Once the COVID thing has been adjusted, and how we're going to engage with an outside world, do you have a concern about the fact that all of a sudden, boom, these regulatory restrictions appear?
Well, I kind of see, and this is my personal opinion, I don't think we're ever going to go back to the normal that was before.
I don't think so.
Mm-hmm.
And I think, for us, interestingly enough, we are reaching more people virtually. Our programs now are reaching people statewide instead of just within our chapter territory. We're giving constituents more choices, more options of attending programs, attending a support group, attending a joint enrichment activity. We're sharing a lot of things now statewide. And I honestly think it's not going to be till 2021 before there will be any discussion of any in-person gathering of any sort. Even when we do start to go back into the office, I think this is going to be a very long process. And if we end up with a spike in September, that's going to put us back. Who really knows? I think this is causing us to look at other platforms to provide programming. Yes, us bleeding heart social workers are very resistant to virtual for exactly how Sharon said. There's that, you lose a connectivity when you're not in the room with an individual. However, we have to figure out some way of remaining connected if we can't physically be in the same room. And so I think guidelines are going to change and remain changed. I don't see it going back. And I see us in the future, even when we get to a point where they're saying, yes, you can start having groups again. I know our constituents are not going to come to groups. I know they're not going to feel comfortable, no matter how many safety protocol, safety procedures we have in place. There's going to be a certain level of fear. And I think we're going to have both a dual platform from now moving to forever of both virtual, telephonic, and in person.
How about you, Sharon? Or Emery?
No.
How about, no, please, Emery.
Oh, I absolutely agree with you, Meg. I think we are going to go into a new normal, but it's not going to be our old normal. And I don't necessarily think that's going to be a bad thing. I agree with you that we're going to be doing a little bit of what we used to do, but we're going to be doing a lot of what we're doing now, and we're just going to be enhancing that. It's really shown that, especially for the caregivers, we're doing virtual support groups. They're loving it. Now, there may be people that want to have the one-on-one interaction, but there's still those people that we've caught that are going to be able to say, I'm going in my bedroom for an hour so I can talk to all of my friends virtually and I can just kind of vent on what's going on. We didn't realize how important that was and how much people really were thirsty for it until there was no other option. So I think that's a really good point that you brought up. I also think it was interesting that you said you're going beyond your catchment area, as are we. We'll get calls on a daily basis. I got a call from a woman today whose 73-year-old sister lives in Orange County. She lives down in Baltimore. She hasn't been able to reach her. She's nervous. Will somebody, go over there, knock on her door, make sure she's okay? She was fine. Her phone was dead and she couldn't find her charger. So that was the problem. Well, I probably talked to her 3 times, and all of a sudden she's like, can I join that support group that you have? Do I have to be in Orange County? I said, no, anybody can join. So those are the good things, and I really try to look at glass half full. I think we're going to be able to do so much more, and it's going to be so much richer. And I think this virtual coalition is a huge example of what we can be doing.
And that's a great point. And Sharon?
Yeah.
I agree wholeheartedly. This has opened up avenues that were there that because we have become so used to doing business a certain way, we didn't bother to investigate, and we were forced into it. Change is not always easy, but it almost always is positive.
Yeah.
The reality is you, Meg, and you, Sharon, represent vulnerable populations. Okay? At that point that you made before, Meg, about, that your constituents may not remember to wash their hands, may not remember to do the ADL, the activities of daily living. And the two of you sit here, and we're so glad you are here, and you represent vulnerable populations. But I'm hearing across the 3 of you, Anne-Marie and Sharon and Meg, that your reach is wider. So that even though in many ways we talk about this being restrictive, the situation we're in, or constrictive, but here you are sitting here talking about how you've been able to reach wider and further, and to people that may not have been able to, make this connection with you. So I think that, out of this, and, Anne-Marie's point about, the Elder Abuse Awareness Virtual Coalition, we would not be sitting here if it not had been our ability to respond to the current situation. We would not be sitting here without our ability to be able to fund this and plan for it, through the work of the Office for Aging, through our Center on Aging and Disability Policy at the college, and St. Luke's Cornwall Hospital. I mean, that's how we arrived there, because our intent was to, continue to do the assemble, let's have more conferences, let's have more walks. But Emery, you want to add to that about the role of the St. Luke's, because they've been wonderful supporters of this.
St. Luke's has always been a wonderful partner with us from long ago, and they continue to be. And we've always said the way to eradicate elder abuse is through education and awareness. That's the dirty thing that people brush under the rug and they don't talk about it. Nobody talks about it. Even the people that are being exploited and abused, they don't want to talk about it. It's a difficult thing. And St. Luke's plays such a crucial role, because you have somebody that goes into the hospital because they fell. Well, why'd they fall? Is there a reason why they fall? And maybe they fell, but as they're being checked out, they've got some bruises that are old. And where did these bruises come from? And Dan Wan, who's the vice president there, is amazing. He's our great friend and our great partner. And, he's trained everybody to start asking these questions so that we can get to the bottom of it. And again, awareness, education, shouting it out. Dr. Forrest, age loudly, that's exactly what this is. We're going to talk about it. We're going to pull this, rip the Band-Aid off so that people can see it. And that's the only way it's going to stop. So the partners that we have are so incredible. And I'm part of a 5-region, our caucus is a 5-region, which is Dutchess, Putnam, Rockland, and Ulster. And I will tell you, even before the pandemic, we always had a very good working relationship. That's not always the case. I'm on the state board, and I would hear other counties that, well, no, we don't talk to that county because this is ours. And there's real silos. And it's not that we had silos before, but we've just enhanced our work now. I just was on the phone with Sue from Ulster County this morning. We were talking about a case together. There's no, what can we do to help? Should we call Alzheimer's? Should we call our partners at Jewish Family Service? I think that's the really wonderful thing about this, that this has come out of.
And, Anne-Marie referenced the age loudly. Sandy Altman, who is an attorney and a senior advocate, approached me about 2 years ago about doing a podcast. And matter of fact, the representatives of this membership of this virtual coalition were on that podcast. And, I think Orange County is so rich, although Sharon is in Ulster but reaches out, Meg is, multi-county. But Orange County, and I've said this to you before privately, and I've said it publicly as well, that you, Anne-Marie, truly represent, how to do business, from a government perspective of reaching out to educational places like the Mount, to reaching out to private agencies. And you, Sharon, and you, Meg, you're sitting here because of the fact that when we talked about who did we want to join this and add voice to it, there was no doubt that the two of you, wasn't like you were second and third, you were the top of the list because of what you do. And the interesting thing is that as people get to know the membership, is it an irony? I don't think so, but we've all been friends for 20, 25 years. And we're still playing together because of the fact we respect what everybody does. And this virtual coalition started off, in a discussion with Anne-Marie, Tim, and myself, Tim Murphy. And then we brought Dr. Jerry Abatiello into the discussion and Alyssa Jill Williams. And Alyssa was able to take our idea and with the team that she has assembled, be able to light it up. And within 12 days, we were having our first interview.
She did
That's unheard of.
She did magic.
What's that?
She did magic.
Yeah, you really did. So, Alyssa, we're going to turn it back to you as you get contact information from everybody about how they can reach out, be connected. But again, our hats off to you and the team that has been working with you.
Thank you. And this is such a great time because if somebody suspects something going on, we want to make sure that they have a platform to reach out to. We really believe as multi-agencies come together that it's better to say something than to let it go unsaid. So if you would each like to, we'll start with Anne-Marie, give the phone number for people to call, and then maybe a little bit about what they can experience when they do call that phone number.
That would be great. Thank you. So you can always call our New York Connects number. It's our single point of entry. about an array of issues. It's 845-615-3710. If you feel that you may be a victim of abuse or a scam, or if you know somebody that is, if you know a neighbor and you're not sure of, you can either call us again, 845-615-3710, or you can call Adult Protective Services, which is 845-298-7100. Sorry, 2800. 291-2800. You can call them and you can do it anonymously if you're not sure and you're like, I think something's going on with my neighbor, but I don't want to interfere. Always err on the side of doubt. So just do it, check it out. Best case scenario is it's nothing. You know, worst case it is something, but you alerted the authorities to it. So again, Adult Protective Services is 845-291-2800. I want to do really quick a new scam that's coming out that I want everybody to be aware of. It's up big time up in St. Lawrence County, and they're sending out a census form, which census is very big. We need everybody to send out the census forms. It looks exactly like the census form, the original one that you get. The only difference is on the bottom, it has a part where you can donate $10 to the Senior Advocacy Fraud Scam. So if you want people to not be victims of fraud, give us your credit card number, give us your checking account number, and we'll just take $10 from you. It's a scam. Don't do it. The census is not asking anyone for money. That's all I have. Thanks.
Thank you. That is great. And Sharon, how can people reach out to your agency?
They can reach out by calling 845-338-2980, and that's for services, or if there is a concern about elder abuse, you want to run it by us, you can do that as well. However, in New York State, Adult Protective Services is the reporting entity for elder abuse, so reporting it actually has to go to the APS in the county that you are in. You can also call New York Connects in Ulster County, in Orange County, in any of the 5 counties that are in our catchment area, and they will direct you to wherever you need to go. Anne Marie, is there still a 1-800 number for New York Connects that links everybody to where they need to call?
There is, and while Meg is talking, I'm going to get that number.
Yeah, I don't remember it, and I should.
I'll get the number while Meg is talking.
And Meg, you know, your segment of the population sometimes not being able to advocate for themselves, but if someone sees abuse happening to someone with Alzheimer's or wants to get involved in one of your support groups, how can they reach out to you?
Sure. We have our 24-hour helpline, which is 1-800-272-3900. We have master level social workers 24 hours a day, 7 days a week, 365 days a year. It goes to our contact center, and then we provide local follow-up. Also, alz.org is our website to go and find your local chapter. Yes, if you think there is abuse happening, we're actually dealing right now, one of our care consultants is working with a family, actually a neighbor, who thinks that abuse is happening next door. So, this is, it's kind of interesting how this came up the same time we're trying to help this neighbor who's trying to help her neighbor who she thinks is being abused. And she called our 800 number, and our folks at the contact center are able to make direct contacts with all of the local adult protective services in order to get action happening.
Fantastic, and good luck as you work through that.
Thank you.
Anne Marie.
The New York Connects 800 number is 800-342-9871. So if you're not in the 5-county area, please call them and they'll help you. Also, the Adult Protective Service, it's not an 800 number, it's an 844 number, but you can call that. It's 3505, and somebody will help you with that.
Okay, well, thank you so much. And thank you, Meg and Sharon, for joining us today. And thank you for joining us today. You've been listening to the Elder Abuse Awareness Virtual Coalition. And if you want to hear this program again, or share it with friends, or even comment on it, you can do so on our website, www.elderabuseawarenessvirtualcoalition.com. You can also follow us on Facebook, Instagram, and YouTube. And while you're on our website, make sure to sign up for our newsletter. We hope you can join us next week as we continue our conversation of elder abuse awareness. Thank you.
Thanks.